Okay, we are live. Hello, everybody. I'm trying to also go live on Instagram if you're over there. Let's see if this works. Live video. That may or may not work. Okay, I'm going to go live over there as well. So, welcome everybody. Thank you so much for attending today's Whole You community meeting and community session. Today's topic is one that's very near and dear to my heart. It's about skin issues, and I'm here with Dr. Azizian, who I'll be introducing in a moment. But she came up with this new book called The Clear Skin Diet. She just published it last week, in fact, and I bought my copy on Amazon. Apparently, it's sold out, but she'll give us details on how to order it. And she's going to go in step by step describing the book. I wanted to start off telling you a little bit about Whole You in case you don't know about it, and then also why I'm so interested in this topic. So my name is Shannon O'Brien, and I founded Whole You Career and Life Strategy about 12 years ago. And the reason I focus on Whole You is that it's not just career and getting your career alignment, also being of service to others and service to society. It's also wellness, and wellness is the baseline, and also the topic today is about wellness of mind, body, and spirit, and also wellness of skin. And I have a very personal connection to this topic. As I said, I'm going to share my screen and show you and tell you a little bit of a story about my background with these skin issues. So let's see. Hopefully you can see this. Now, lunchtime is over, so I know these are not very appetizing photos. But in my 20s, I started to get really bad acne, and it was all over my face. It was like devouring my face top to bottom. This is what you see on the left-hand side. And when I went to doctors, they said, well, you can either go on birth control or you can take Accutane. And when I read the fine print of Accutane, it said one of the side effects was depression, suicidal tendencies. And I said, wow, well, I really don't like the acne. It makes me so insecure, and I don't want to look at people in the eyes, and I'm so embarrassed by it, but I also don't want to have suicidal tendencies. So, and then it was interesting. I was working at Harvard at the time, and a colleague of mine said, I just read an article that milk or dairy might have something to do with it. Now, this was, I was sort of in my late 20s, and I hadn't ever made the connection between food and what I was consuming in my skin. I'm just so used to like Western kind of medicine saying, well, put a cream on it or take a pill and try to solve it. And so then in my 30s and 40s, I started to develop eczema on my skin, particularly on my fingers and my hands. So it was a very, very deep, itchy rash, puffy pustules, really, really so itchy and painful and terrible. And again, if I went to a doctor, they would tell me to put on a steroid cream. I did more research, and I found out that maybe if I reduce gluten, that it would be better for my skin. And so I kind of experimented with that. And this is a different topic. This isn't necessarily food related, although I'm interested in asking Dr. Azizian. But at one of my jobs last year, they had a requirement to get a flu shot. And I had a sense that I was going to be allergic to it. And sure enough, immediately after getting the flu shot, I had a mast cell activation and this big rash all over my body that lasted for months. So as I said, very personal connection to issues related to skin. They're really debilitating and can alter your life. So that's why I'm super excited and honored to be talking to Dr. Azizian today, who's going to demystify and hopefully give us solutions in a natural way as well, perhaps with just food and watching what we actually put into our bodies and how it affects our skin. So I'm going to pass it over to Dr. Azizian. Now, I want to tell you a little bit about how I came across her and her page, her YouTube page, which is full of very insightful, informative videos, which I'll share the link with you later. But she has a brick and mortar practice called Mindful Medical Care. It's in Falmouth, Massachusetts. And I remember driving by it and seeing the title, which obviously very appealed to me because of my interest in holistic health. And I actually went in for a skin evaluation. It was summertime, and I wanted to see if I had any precancerous things. But I learned about her approach and how it's this holistic approach and also has functional medicine. So I just am a huge fan of her and her work and her new book. And I think you're in for a real treat. Dr. Azizian, please tell us more.
Well, Shannon, thank you so much. That was a very kind introduction. Thank you. Thank you. So I appreciate what you're saying. And yeah, while I was listening to you, it always, like I feel exactly the same, and when you see somebody like yourself telling your journey, right? Be it the skin or be it, I don't know, could be migraine, could be joint pain. Skin is sometimes is more uh, kind of, forgive me for my pun, but inflammatory for people because people see it, because you can, like people, internal problems are not as visible as external. So, and and there's a lot of sort of social stigma and embarrassment if you have some visible issues. Well, but everything that we talk about in connection between food and our health, it's both the skin and internal issues as well. So I feel exactly like you do, and it's in some ways it's magnified because I see so much of it on a daily basis with my patients. And what is very common to see is somebody come in with an external issue, and it could be, again, eczema, it could be psoriasis, I don't know, seborrheic dermatitis, acne, whatever the skin condition is. But the key that it's a chronic skin condition. It's not like a little one time, because we all get like a one time rash that happens, like poison ivy, you got something like. So we're not talking about this one time, sort of like once in like 20 year, like a little flare up for whatever the reason. We're talking about a chronic condition. And when people come in with chronic condition, there are two ways to look at it. And just like you said, a conventional way is the way of giving people medications. And a lot of times we do, I have to say, in conventional medicine, we do give steroid creams, because steroid creams work for a variety of conditions because they target inflammation, right? And a lot of conditions, they are based on inflammatory cascade on our immune system. So that's why they work. But the bottom line that they don't work in the long term. And I call it a band-aid approach. So just a little bit about how I personally got into it. So I'm a board certified general surgeon, and I one of my loves is subspecialties is skincare. So in the practice in Falmouth, I do take care of skin disease, both benign and cancerous, and both diagnosis and removal of skin cancer. So, and in the process of doing this year after year after year, there was this sense of like, I could be doing better than this. I, as a representative of a Western medical approach. And again, it's not about that it's wrong. It's not wrong. It's just not enough, because I'm not opposed to prescribing steroid cream here and there. It helps, and it sometimes it can just take care of the problem right away, and it's a huge relief for the patient. So I'm not against conventional medicine, but when you deal with a chronic issue, it's day after day after day. You want to find out why. First of all, there's a component of intellectual curiosity, and second of all, it's really like my job, what I basically dedicated my life to and I enjoy doing is being a doctor, helping people, as simple as it sounds, but you really want to make a difference, and you don't want to keep putting band-aids, like I said, even if they work, but they don't, ultimately you want something real, you want to help. And from that, and of course on many levels, I felt that way, that there must be more. And that's how I got into functional medicine. And I was first I started reading work by Dr. Hyman, Mark Hyman. Everybody knows him. He's just amazing person. And then I got into Institute of Functional Medicine, and I got certified and became a certified functional medicine physician. And it has been an amazing journey, because it's almost like I see another side of medicine, which is full of new things, because a lot of it in conventional medicine, things progress slower. They do progress, but they're slower. Like we've been prescribing certain medications for years. It's the same thing. But in functional medicine, there is so much research going on, and there's so much newness that it's truly exciting. But the bottom line, honestly, like you said, it all starts with the lifestyle. It all starts with foods, with lifestyle. And in my book, I focus a lot on foods because, but it's not only about foods. It's about your physical activities. It's about the sleep that you get. It's about your connections with people, both like close connections and community connections. So, but of course, foods are number one because you start with foods. That's changing your diet, changing what you eat. And then, of course, there is a room for supplements too, and that's how you come to good health. And it is a journey. It's not a quick fix. I say on my, I have a YouTube channel where I talk a lot about functional medicine issues, about skin and foods and some other topics. And I always say those things are not a quick fix. In some cases, you could be lucky, like you were saying, like when you stop dairy, you see changes. And in some people, it could be very fast change. Like you stop, let's say every day you had ate tons of dairy, and then you stopped, and then you can see a change in a few weeks. That's beautiful. But in some people who have been eating certain unhealthy foods day after day after day, like it will take time, because as long as it took for you to develop your chronic issue, whatever it is, skin related or not skin related, well, it will take long time to, for your body to change, and your body will be thankful, very thankful for that. So
I just want to say, actually, quitting dairy didn't actually solve my problem fully.
mhm,
I ended up, because I had it for about 10 years, I ended up doing an experimental laser type thing.
mhm,
I think
mhm,
Dr. Rox Anderson down in MGH, or one of the hospitals downtown Boston.
mhm,
So that's ultimately what helped me cure it. So
mhm,
um, I think that cutting out dairy, specifically milk, because I was going to get these large chai lattes with
mhm.
milk every day. But cutting them down, reducing them certainly helped a lot, but didn't 100% cure it. And to your point, this is before I knew about lifestyle medicine and the kind of the multi-prong approach, but it certainly did help to lessen it. So I just wanted to clarify that.
And I use that example because sometimes people think linearly. They think, well, I eat one food and eliminating, but usually it's not one thing, right? It's rarely, and it's good if it's one thing because it's easy, right? Because human brain, we always look for a linear relationship, but in many cases it's many things. It could be foods and not even one food. And in my book I go, for example, like I talk about acne and all the foods that can trigger acne, which are multiple foods. So we'll start with like dairy, and then there is of course chocolate. There's a lot that can trigger it, even not conventional foods that can trigger it. But also don't forget aspects such as, it's not a simple thing, such as stress that also comes to it. So it's not one thing. But I would like to share a very kind of dear to my heart saying that in functional medicine, we say in functional medicine, if you're sitting on two thumbtacks, you remove one thumbtack, you still have pain, right? So it means that you can remove one aspect of what's causing it, but it's often more than one. So that's why having the whole body approach. So like in our clinic, what we do several types of kind of services. Well, one of them we just do, for example, gut testing. We check leaky gut. Another testing, we do food sensitivities, and we check for food sensitivities. So but we also have comprehensive course where we do more, like over several months we follow somebody, make changes, and do testing and everything else, because again, everybody has special uh, uh, everybody has their own needs, so you can't just throw the same thing. In conventional medicine, we often do throw the same thing. So but and some of it is, sometimes it's justified, I have to say, sometimes it's justified. But in functional medicine, the whole point of functional medicine, that it's personalized. Like some people are use this example. It's in my book as well, like how our relationship to caffeine, right? So some people can get away with drinking 3 cups of coffee per day, provided I'm talking about average size of coffee, not huge. So, but some people, based on their genetics, are only, well, allowed, so to speak, 1 maximum 2 cups, because after a certain amount of caffeine, the research has shown that they're they're prone to non-fatal heart attacks. Because why? Because they don't metabolize caffeine in a normal way, because they're slow metabolizers. And let's say you don't know you're a slow metabolizer and you drink 1 pot of coffee per day. So see how everybody's different, but somebody else may get away with, somebody who's a fast metabolizer can get away with that. Not that I encourage drinking 1 pot of coffee per day, but they can get away with drinking 3 cups of coffee. So that's why everything is personalized. And in my book, what I try to do, I try to basically put some scenarios, in the sense of, like, this food can cause XYZ, and this is a component of food that could be causing food sensitivities. And again, everybody is different, and you need to know your, for example, food sensitivities, to know which one applies to you. And in some cases, you need to know your genes, like in caffeine, right? In caffeine for milk, and for some other, and for some other foods. Yeah. Hmm.
So is that you would need? Is it possible to figure out whether you're a slow metabolizer based on taking that test and seeing if you have the gene or not? Or
Yeah, and
okay,
that's one of the most attractive things in functional medicine, for not only for medical sort of medical public, but also for general public, right? Not only for specialists, because we are very used to following science. And that's a good thing, because when you start treating something without any evidence, that's just not right. It's just not, it's a wrong type of medicine, let's put it this way. So you have to have an evidence. You can't, in some situation, let's say you've exhausted all the tests and everything, and you say, well, this is my clinical suspicion, because we ruled out everything. But that's kind of its own issue. But in a situation, let's say, if you say to somebody, I think that you have you may have yeast, right, in your gut, or something to that effect, right? You have to prove it. You have to do the testing. You can't just throw these things. So you have to have a lab test, or at least a very substantial clinical exam, physical exam, because there are obviously physical signs on physical exams that give you that information, but not specifically for the gut, right? On physical exam, for example, you can say to somebody, oh, I see that you have a yeast, for example, under the breast, right? Candida is very common under the breast. We see it in our clinic all the time. But looking at that, I can't say to somebody, I think because you have yeast here, you have yeast in your gut. They may, but this has to be proven. So to answer your question, everything that is said or is treated has to have a scientific base. And that's why these labs, in our virtual, we have a virtual clinic, functional medicine clinic, to be available for people who don't live in Cape Cod. It's called iLabMD. So in that clinic, we offer the tests, because they give you the information. You need that information. So are you a slow or fast caffeine metabolizer? Who knows? There
yeah,
are genetic testing. Once you do the genetic testing, then you know. And it's a pretty straightforward. That's actually not I wouldn't say it's a fancy test. It's a straightforward test. And that shows you, among many other things, how you metabolize caffeine. So yeah, and I am a strong proponent of that, and I think that many of my colleagues feel exactly the same. Treating something, you need to have a base, you need to have a scientific proof, or at least a very, very strong clinical suspicion. You can't just treat just because, oh, I think that you have this or that. That doesn't
right.
work.
That's what's really appealing, honestly, about these tests and
Mhm.
modern biohacking. I mean, people
Mhm.
might take it to the extremes, but to really find out what's going on with you, the personalization. Because for me, maybe I am, have a reaction to dairy. For my neighbor, or even my daughter with different
Mhm,
genes, might
mhm.
have be able to drink a whole glass of milk, no problem. So the personalization is just so key, and these tests you're describing are very appealing for that reason, to get your own personal story. We do have a question
Mhm.
from Patrick. Hi, Patrick. What type of nutrient deficiencies do you see most often?
It's interesting. That's actually a very good question because it depends. So you may be surprised, but even in today's day and age, we see common nutrient deficiencies such as magnesium. Magnesium is one of my favorite, I don't know, favorite minerals because magnesium is good for so many things. I think I have a video. Yeah, I have a video about that because, I probably could make like 10 videos about magnesium. It's good for your heart. One of the things when person comes to the hospital with heart problems, one of the first things usually they get intravenous magnesium, especially if they have heart rate problems. So for the heart, then you have GI magnesium. As you know, it kind of works as a laxative. In some cases, it's a mild laxative, but depending on the formula, it actually could be a strong laxative. There are some types of magnesium that are much stronger laxative. And also magnesium actually was discovered in a Greek town that was called Magnesia because they noticed that the water of the town had some healing properties, and those were Epsom salts. So then you have like the digestion. Magnesium is very important for digestion, so the list goes on. But to answer your question, so we see magnesium, we do see calcium. One of the things that people don't think about it, sorry about that, I'll turn this off. People don't think about it is also a zinc, which we talk in our clinic. We talk a lot about that because, especially if people have problems with their nails and hair, which we see, right? In some cases, it could be a zinc deficiency. And I have to say, because we see that more so all of these deficiencies if somebody is doing intermittent fasting without supplementing. You do have to especially if you are on calorie restricted intermittent fasting, you do have to supplement. So magnesium, phosphorus, yeah, sometimes. Well, calcium we see, zinc. One of the things that we see in a certain population is B12 deficiency, because B12 is connected with how you absorb things in a GI. So people who are on Ozempic and similar medications, GLP-1s, and actually there's also subgroup of other people, even people on PPIs like omeprazole, right? It's like everybody takes PPIs. They could have B12 deficiency. So B12 deficiency is more common than you think, but sometimes we also see somebody getting too much B12. That's true too, because sometimes like people being overcompensated. But yeah, excuse me, sometimes you see more obscure deficiencies because there are many things that we don't think of it. But honestly, when I heard this question, the first thing I thought was magnesium. Magnesium is so important. Yeah.
Can
Mhm,
I ask about magnesium? Because I did
mhm,
join a program about 2 years ago, and interestingly enough, it was like across the board, this person running the program didn't even ask us to get it tested, just said everyone needs to take magnesium. And
mhm,
it was suggested to take it. It was a white powder.
mhm,
Sounds mysterious. You bought online and you mixed it with um, bubbly water and put it in the fridge for at least 15 minutes. I'm just
mhm,
curious about absorption because I also saw magnesium pills or tablets. They taste really good. They're like great flavor, almost tastes like bubble gum that I bought at Whole Foods, like a bag. Even my daughter will eat them. But I'm
mhm.
wondering, is magnesium or any of these other minerals and nutrients is there some sort of like particular way we need to take them? You did talk about intravenous and GI. That sounds like at a clinic or a hospital, but like at home, in terms of
Mhm,
magnesium, since it's the one that you started with and ended with,
mhm.
is there any like block for us to absorb it?
Mhm. Yeah, well, I mean, the IV was in a hospital. So GI is like a lot of the supplements for that you buy have magnesium in it. A lot of like natural, they're oral for GI, right? And their magnesium actually is very versatile in a sense that I don't want to comment because maybe that was fine the way that they structured how they delivered this magnesium, but a lot of the minerals now, the drug companies, in a good way, they're actually becoming better and better to make these minerals and medications, supplements in general, more palatable, because lots of people have difficulty swallowing big capsules and things like that. So things are changing in terms of having more fun versions of taking in the supplement. So, but many of the most of usage of magnesium is oral magnesium, because it absorbs fairly well in the emergency situation when there is a heart rate problem or cardiac problem, because there is emergency and larger dosage of magnesium has to be delivered quickly. That's why in the hospital it's done in IV version. And plus, often people can't eat, they're not allowed to eat for surgeries or whatever, so that's why they're giving in IV form. But for a regular, like, everyday situation for all of us, just taking magnesium, and there are different combinations of, there's for example, magnesium oxide is common, but there are others. So that's one of those staples. But I actually, while you were asking me that, I thought of another vitamin that usually is not enough for most people, especially living in Northeast, is vitamin D.
Vitamin D. Mhm.
And vitamin D, most people just are deficient in vitamin D. But again, having said that, any of these vitamins and supplements, there is a something like too much of a good thing. Like, yes, if you overdo it, you may have some toxicity reactions. And I bet you, if you go to the emergency room, like having this unusual reactions, it may be very hard to like clinically diagnose that. But once they run the blood work, they will see that if your magnesium or whatever is elevated. But vitamin D, for example, is usually deficient in most people in Northeast, especially in the winter. It's even more deficient. But it's a fat soluble vitamin. It's not a water soluble vitamin. So potentially, if you do too much, it could be toxic. But that's actually very rare. Most people are under; they're not over.
So this kind of crosses over, like, how much is too much? We have a question from Lily. Hi, Lily. Thanks for being here. She asks, do you usually suggest replenishing nutrients through diet, or do you recommend supplementation? I know that people can take it to the extremes. I think the founder of Life Force, was it Tony Robbins? And I'm blanking on the other guy's name, but he's saying he takes like 80 supplements a day, like 80 different pills. That sounds extreme. Um, Maybe these ones, is it just finding out what you're deficient and you do recommend getting it from a pill? Because you sometimes hear people say, well, you would need to eat like 6 pounds of leafy greens in order to get that, so you might as well just take the supplement. But what's your thought on that?
Yeah, I touch upon that in my book, because that's another very appropriate, like on point question. If you are young, let's say you're like in your 20s, you eat a healthy diet, you're completely healthy, you don't have any medical problems, I don't think that type of a person needs any supplements, frankly. And if they get, everything in moderation, they have vitamin D from natural sources, such as, I don't know, fish, get a little bit of sun, get everything. So a young, healthy person, most likely, and I would honestly would not recommend any supplements. However, as we grow older, there's several actually conditions that will prompt us to take supplements. First of all, even if we eat a completely healthy food, which most people don't, because honestly it's very hard to do. A lot of foods that we may eat something at the restaurant that is GMO, like we don't really know. But let's say even if you eat completely healthy, your body, as you grow older, cannot metabolize everything, can't absorb as much as you need. So now you need a little help. So who else in that category? Also, people who have chronic diseases, those people, which is basically, I don't know, probably like everybody who's consuming medical care right nowadays. Most people, at least, like medical care now is focused on chronic illness. That's what the majority of medical care is. So most people are taking some medications, and they have chronic diseases. If you have a chronic disease, that also affects your absorption. So you're not getting enough. So based on that, if you have a chronic disease, or you're older, and older, again, that's kind of, I don't know exact age, but I would just say, let's say 40, like 35, 40. So then my approach to that, and I think many of my colleagues would agree, is to start with the supplements that are appropriate for this person, for this specific person. So, and that's actually one of the attractive parts about functional medicine. Like on our iLabMD site, we have this functional nutrition package where we basically, there's a test that we work with very, very like state of the art labs, and we get this functional nutrition which measures your nutrients, and those are micronutrients, which is vitamins and minerals, in your cell, not in your serum, but in your cell. That's a big difference, because a lot of times what's measured, let's say during a routine lab, let's say you go to the regular lab or to the hospital, right? It's a serum, like serum calcium is measured. So this measures inside of the cell, and it measures many other things like manganese and other more obscure chromium and etc. Because now you know this specific person. So I've seen those people who have lots of supplements, and I would a lot of times they have their core supplements that they need, right? That they're low on these specific supplements, but also they take a lot of basically age prolonging rejuvenation supplements too. So there are two types of supplements. One type that you need, let's say you had that functional nutrition test, you know what you need based on that. But you also take something for your mitochondria, you take something like specific, there is now, I actually love this product, like a neuro probiotic that's good for your brain, probiotics that work to improve your cognitive abilities. So then, yeah, I mean, you can add and you can end up taking many supplements.
Yeah, yeah. I like that for the cognitive. I think everybody in my life, including myself, are saying that they have some sort of executive functioning, memory, brain fog, which
Mhm.
is probably related to food as well. I want to get into to transition into your book now. I just have one
Mhm.
follow-up question here that we
Mhm.
had from the audience.
Mhm.
He says, I take a magnesium, bisglycinate powder. Is that a good
Mhm.
form for assimilation of magnesium? Just a follow-up
So
on
it all depends on who you are, what your labs are, what is the rest of you. Because to answer, first thing that any, when I'm asked about supplements, my first thing is, where did you get it? Because before, like years ago, I myself, I actually thought that all supplements were the same. I guess I was naive. I didn't know. Like I would just go and buy, whatever supplements I thought. And then when I got into functional medicine, I've learned so much about contaminations, about heavy metals, about some kind of irrelevant things that were present in these supplements. So first of all, is it a clean supplement or not? That's the question. And in our clinic, we work with, with FullScript, which is a wonderful kind of online thing. So we are connected with them, and that's how we recommend supplements, because they take the job off me, so I don't have to vet each supplement. So, and I just look, is it there, is it not there? And if it's not there, and they have thousands of things, then I would be more concerned to use it. So, and the second of all, the question is it good for you? And not knowing you, I will not answer, of course, that question, because that's against functional medicine thing. It's all about, maybe it's good for you, but not good for somebody else, and which context and why. So it's a good question for your, for a person who recommended, or if somebody didn't recommend, then you should look into talking to somebody
Yeah, yeah. I
about
mean,
that,
this,
because it's all about personalized. What are your labs? What is going on? What is it being taken for? And then you can actually say, oh yes, great, or oh no.
yeah, I think that's a great public service announcement for people to really put on blinders in a way to the advertising or even what other people are saying,
Mhm.
or recommending, and just saying, what do I need? What do I need? Not what am I getting sold to, or what did I read an article about that would be good? Should I use creatine for muscles? Or we
Mhm.
really don't know until we like go deeper. Um, I'd like to transition into your book and getting like the framework and as it relates to the skin, getting back to kind of the
Hmm.
different approaches of being mindful medical care. When we're eating something, how do we react? But I know that you have some slides to maybe share about.
Yeah, yeah. So I'll present right now. So I'll basically just, so here, share screen again, share screen. And sorry, I'm just gonna do entire screen here and share. Forgive me, you may see like some tabs, but I think, can you see it now?
Yes, and I will
Yeah,
add it
great.
to the
So
stage.
yeah, so I'll just go over like the gist of the book, and uh, I'll start with what is important. So what I thought, because it's interesting that I thought it would be a small book, but at the end it ended up being like 300 pages because there's so much to say about things, and I probably could have even made it longer, but I decided to stop. So just I'll just kind of give a very brief summary about things. So the first chapter, which I'll talk a little bit more, but the first chapter is kind of the key as to what is the difference between food sensitivities and food allergies. And the second chapter, I go into the skin conditions related, I'll make it bigger, to food sensitivities that I discuss in this book. These are very common things that we see all the time: acne, eczema, seborrheic dermatitis, which is dandruff of not only scalp but of the face, very common condition. Contact dermatitis, psoriasis, rosacea, very common. Hives, and different types of hives, rashes, and pruritus, which is a very kind of unpleasant condition, itching without the rash, very hard to diagnose it. So I talk about these conditions. Then the second part of the book is, I try to make it simple. This book is, by the way, for people who are, it's not for somebody with necessarily science or medical background. It's just for anybody who loves medicine, loves the topic. I wrote it in a very simple language so that it's not overwhelming. And here I talk about immune system, then I talk about histamine, which is histamine intolerance, and mast cell activation syndrome. And then this big chapter about leaky gut, because leaky gut is everywhere. And I'm sure, Shannon, you and your audience knows that now there's a research showing connection of leaky gut with Alzheimer's, with Parkinson. There's just so many things that every day we hear more about leaky gut. So if I have to do another edition of this book, I'll probably add some chapters, even though I'm focusing on the skin, but I do talk about other things. And then we talk about hormones and food sensitivities, which is very huge connection there. And then the heart of the book is specific food. So I start with the gluten, and then dairy, and kind of like break it down. What are the reaction? What happens? What's causing the reaction? How does it affect specific skin conditions? Then I have soy. Sugar is a lot about sugar. Sugar is one of the worst ones. So then eggs are very common, both as allergy and sensitivity. Nuts and seeds, caffeine, we kind of touched upon a little bit. Wine, it's a big one with lots of things that could trigger skin. Chocolate, FODMAPs. FODMAPs are fermentable, actually, oligosaccharides, disaccharides. It's special substances that are not necessarily unhealthy by themselves, but people could have sensitivities. For example, lentil is one of them. Lentil is a very healthy food, but unfortunately, it is a FODMAP, and some people could be reactive to it. Shellfish, very common. Nightshade vegetables like eggplants, for example. And then we have like sort of the culmination of the book, which talks about how to diagnose food sensitivities. And we do a lot of that in our clinic, where we offer testing for food sensitivities. We work with the local company, that KBMO, that provides us with a very good service. They test for 176 foods. So that's very interesting. And sort of the culmination here is utilizing everything, like the whole thing. And I'm just going to, what I'm going to do, I'm actually going to jump to most, I think probably I usually present this first chapter because that makes people understand what the book is kind of all about. So I'll just talk a little bit about that. So the difference between food sensitivities and food allergies. Food allergies, people know that they have food allergies. Usually it's something that they've had as children and it continued. Sometimes you can grow out of some allergies. That does happen, but the difference is, I usually say food allergy is like dramatic and immediate. You eat something, you have a reaction, and sometimes it could be a life-threatening reaction, like you can have anaphylaxis, you can have your throat closing, so that's a true medical emergency. But the problem with food sensitivity is that they're so subtle that you can eat something and it may take up to 72 hours to have the symptom. And the symptom could be migraine, could be a rash, flare up of eczema, it could be your joint pain, could be nasal drip. It's very hard to investigate the connection. So that's sort of the overview. Immunology, right here, I go into that, is different as well. Those are two completely different things. So if you got tested for allergies, like recently we had a patient come in who had a very nice testing for allergies, but allergy is goes through IgE antibodies, which are immunoglobulin E, while with food sensitivities we have IgG antibodies and sometimes IgA. So it's a different mechanism. So you are not, let's say, corn. You may not be allergic to corn, but you may be sensitive to corn. Those are two different things. So allergies don't test sensitivities and vice versa. They're just different mechanism. And onset, like I said, with allergies, it's quick, it's dramatic. With food sensitivities, it's prolonged. And what happens sometimes that some people may have a chronic condition. Let's take, for example, acne. Like they have acne, they have it all the time because they eat the same foods every day. So their body doesn't have time to, like wake up to rejuvenate itself because they're constantly eating the same food that they're sensitive to. So diagnosis, I mentioned that I go into both allergies and sensitivities, but in our clinic, there are many tests that are available for food sensitivities, but some of them are better than others. So we work with a company, like I said, KBMO, that had initially they actually created a patent for HIV testing in the 80s. So it's a very reputable and good company, and they test IgG antibodies and these immune complexes that react to 176 foods. So that's very helpful. That's a good test. So another difference is longevity with food sensitivities. Food sensitivities, you can grow out of them. By the way, food sensitivities, they can disappear over time, and especially if you work on improving your gut issues, because most of the time it's connected to your gut issues. While food allergies, unless you grow out of it, like from childhood to adulthood, usually you can't grow out of it, and they're kind of like for the rest of your life, unfortunately. So, and then I talk about half-life, sort of on the same topic, food, amount of food that is needed to elicit a reaction. So for allergies, as some of you who have allergies knows, that you can take a very small amount of what you're allergic to, and that can actually cause huge reaction, huge, that you can have anaphylaxis just from smelling or whiffing, like peanuts, for example, if you're allergic to peanuts. But food sensitivities are not like that. Once you eliminate them and start reintroducing these food sensitivities, you can actually eat small amounts, which is very encouraging, and you can tolerate small amounts. So it's much more fun, essentially. I also want to show. Let me go back in here. So that's kind of first chapter. So I'm gonna.
Dr.
Yeah, go
Azizian,
ahead while I'm
can I
doing
pause
that.
and just ask a
Yeah.
question since it's quite
Mhm.
related?
Yeah,
I
yeah,
was
please.
talking to a friend recently who said her daughter is allergic to eggs,
Mhm.
serious allergy, immediate reaction. And I was interested to learn the process of going back to the doctor and trying to introduce a special recipe of muffins with just a touch of egg. And again, she had this reaction. So you said that sometimes it's available, I mean, possible to, I think that's what they're trying to do is maybe like introduce it in little amounts over time. But you said something about getting the gut in shape in order to do so. Was there like, Is there
Yeah,
something else you could do, or is it
yeah.
really just some luck?
Yes, you have to be super careful with that because again, people call, like colloquially, people call everything an allergy. Most people don't use the term sensitivity, but those are two different things. I suspect that this scenario that you just brought up, that this person does have an allergy, that the child does have an allergy. With allergies, you have to be much more careful reintroducing it. It all depends on the severity. If the allergy is extremely severe, then it only could be reintroduced in a medical setting, but like supervised by the physician and everything else. So it's a very kind of it's very careful decision. While with food sensitivities, that's different. I mean, even if you haven't cured yourself, and I'll talk about it for a few minutes, if you still are sensitive, well, the worst case scenario, you'll have flare up of your chronic condition, be it a brain fog or migraine or whatever it is. You'll eat those eggs that you're sensitive to. And so how do you cure, so to speak, food sensitivities? Let me show you this, and then I'll close the book so I'll see you back. So yeah, so right here we have the food sensitivities. I don't know how you can see it. Yeah, so I'll just read some different groups: dairy, fish, grains, vegetables. There's nuts and seeds, spices. There's also food dyes in here. And then when we get the results, so this is, by the way, a blood stick. It's just finger stick test. So this is, for example, a result like somebody who's 4+. This is a high level of high reaction, and this person is a pineapple, wheat, different components of gluten as part of wheat, and then less of severe reaction 3+, and even less severe 2+. So that's how the report looks, and then they show every food. Every food that got tested, it's all color coded here. So, but let me close this. I'll stop sharing and I'll answer your question about the gut. So I'm just gonna um, come back. I'm stopping sharing here. So I'm coming back here. So yes. So basically, how do you cure food sensitivities? It's what functional medicine work is. It's first taking care of your gut by changing your diet completely, eliminating. First, you have to eliminate those foods, especially the red ones, the 4+. That really is recommended. The orange ones also, the yellow ones, maybe sometimes. It's hard. Some people have a lot, and some people don't have a lot of foods that they are sensitive to. Everybody is different. So, and then you do take some supplements. Again, they're tailored to you. In my book, I do put like which supplements are good. But of course, I am a doctor. I have to put every kind of disclaimer, because I don't want people to say, oh, because it's written in a book, I should go take. No, it says, for example, if you have kidney disease, don't take that. But for most people, it's a good, that's a variety. So anything that we say, because everything has to be personalized. But there are, of course, things that are more or less good for most people. Let's put it this way. So you've been, let's say, on a good diet, on a fresh whole food, fiber, fruit and vegetable, avoiding processed meats, avoiding simple sugars, avoiding all this like snacks, like crackers. Those are all, cereal. That's a dessert, processed dessert, essentially, and a bunch of other, for the list can keep going on and on. And then you take the supplements, whatever you need, again, for your needs, not just generic, but whatever you need. And then usually in certain time, and that time is different, could be 3 months, for somebody else could be 6 months, for somebody else could be even longer, but usually I would say 3 to 6 months. You see like how much better you feel, everything is better. And now your leaky gut, which usually food sensitivities and leaky gut are correlated, now it's better. You feel better, everything is better. So you can try to reintroduce one of the foods that you're sensitive in small amounts. I always tell patients, please don't reintroduce in a huge amount, because it's just not good, but in small amounts, and you may be totally fine without your symptoms coming back. And that's often what happens. The symptoms do not come back. If you, let's say you had 4+ reaction to strawberries, you didn't eat them, and they've been, good, your gut feels good, your symptoms are gone, and now you bring back strawberries, you can try it. And if you eat one or two, you feel great, Well, that's good. So it's not like allergy. With allergies, unfortunately, like some allergies, like I said, you cannot do that because immune system is not sensitized to that. And even like 10 years later, you eat something that you used to be very allergic to, you'd still be allergic to. If it's true allergy, it's very dangerous. But food sensitivities, it's a different story. So they're not allergies.
Yeah, thanks for that distinction. When I was having this eczema flare up and I would go to a restaurant, I would say I'm allergic to gluten, and then they'd always come back and say, "Is this a real allergy or just a sensitivity?" At the time, I didn't know the difference until I read your book. Like the extremity of it. So, yeah, now I will not scare them into saying that it's an allergy. Like I would have this, a serious reaction, but it's
Yeah.
just like a gradual buildup, I think, um, of the reaction on my hand. Well, of course, we're open to more questions, but I want to share. You so kindly provided. I know you said give us the status as I share the QR code for people to go direct access to your book. You said it was sold out, but what is the status on restocking? I'm sure Amazon is pretty good with that.
Yeah, no, it was sold out locally because like I had a bunch of copies. We were selling them in our office, obviously, of course. So, but that we all sold out. But on Amazon, it's a regular sort of purchase, and it's a ebook or a paperback, however you like it. I know some people just like paper, and some people just more convenient ebook. So on Amazon, yeah, it's available. It's just in our office for local because we had some phone calls about that. So we sold out in our office. But thank God for Amazon. They're never
Yeah,
sold out.
absolutely. Well, hopefully people can take a screenshot of that QR code. Thank you so much for sharing that framework. Are there any other things that, like, how can we contact you? Let's put in, type in your website, for example. Like, that's probably a great place to start and probably goes to all of the different places people can learn more from you.
Yeah, of course. What we do is, we're located, like I said, in Cape Cod, like you mentioned, Mindful Medical Care. That's our skin clinic, but we do see people with functional medicine issues too, because I love seeing people in person. I am a people person. I enjoy being with people, like, and in person, I love being in person. So, but that's not very realistic, especially for people who live far away. So we do have our functional branch, which is easier for people who don't want to come to the Cape. And it's called iLab MD. And with ilabmd.com, like I and lab LAB, because we do use lots of labs. It's lab dependent, and MD because it's an MD site. It's not a site for for a company, some companies selling labs. Nothing wrong with that, but it's a MD site where I do consultations and labs, but it's not like, how can I say that? Some people need labs, some people don't need to start with the lab. They just need to figure out some basics. So, but yes, so iLabMD is the site. It's a virtual functional medicine clinic. And I do consultations. What we actually do, what we started doing recently, which actually has been working out very nicely, we do this very short kind of, a lot of people don't know where to start. That's the problem. They be like, where do I start? And
Mhm.
sometimes people think that they have lots of problems, but sometimes that's not the case. It's not that bad sometimes. So what we created this basically a short, like personalized health report. They fill out a long medical form. It wouldn't be a medical site without a long medical form. So you just fill it out, like your long medical form about your condition, and then I analyze it. I look at your medical history, like your medications. You have a HIPAA protected site that does all that stuff. Very easy, but it's a medical form. And then I basically send the patient a report, and I do it in 24 hours. I send them report like based on on like first glance, this is where to start. Like, of course, it's not a comprehensive report to just like, I don't know lots of things about them, but it's somewhere how to start. Where do you need to focus on? Be it at our clinic, we're happy to have you for treatment, or not our clinic, whatever you choose. Or sometimes you need to see another specialist, like medical specialist, for example, not even functional medicine, but something else, because there's some other issue that is not doesn't need to be addressed with functional medicine first. There are some issues like that, like orthopedic issues, etc. Like that that's a pure, medical issue, right? So this what personalized health report, and then they have a 15 minutes with me, and then they ask me questions based on my report, and now I know about them. So this has been a very good sort of a new service that we introduced, because that way I already know something about the patient. I can give them some recommendations. Again, it's not comprehensive, but at least it will kind of send them on a correct or some paths. They will start and then they will get to the right place. So either with us, because then we will introduce testing, etc., or it maybe they just want to know where to start. So but we do like a more comprehensive, of course, treatment course with like bunch of visits and the labs and everything else. So we do variety of things. I do have to say again, because that's very important, that our clinic is only for residents of Massachusetts, Vermont, and New Hampshire, because that's where I'm licensed. So I can't
Okay.
see people from other states. Sorry.
We have another logistical question, which you always hear when it comes to medical offerings. But does medical insurance cover your services or part of it, or part of the cost?
So no, the simple answer is no. That's actually part of why we have this new kind of like a personalized, short personalized report, because it's only $50. It's affordable, because at least you can get started, not spending fortune. Especially maybe you don't need the test that you're purchasing. You may not need that test, and you're spending money. All of these tests are not cheap. That's just the reality. Unfortunately, they're not cheap. The companies have not decreased the prices. In fact, one of the major companies, unfortunately, and one of my favorite ones, just increased their prices. And I don't know why, because now they have more competition. So one of the tests that does get covered, usually, I don't want to say everybody and everything, with a some Medicare is covers a leaky gut test. So we've actually had good luck. We just had probably most Medicare patients did get covered. But again, I don't want to say all, because there's some distinction. But everything else, consultation and everything, we can always provide a super bill, but I wouldn't really count on that.
Yeah, it
Much.
seems
I
that
don't think so.
that's
Honestly, I
very
don't.
common
Yeah,
nowadays. That I have found the insurance jungle very difficult to navigate when you're trying to take
it's
a
very
holistic
hard.
approach. Yeah, it's a frustrating process and an expensive process.
Yeah.
But thank you so much for sharing all of your wisdom. I want to put up here again. It's in the bottom corner, Mindful Medical Care, also ilabmd.com,
Yeah, yeah.
to find out more about you. And I'm sure that will link to your YouTube channel as well. Any final comments before I kind of wrap up?
Well, thank you so much for having me, because, all of these things that we discuss, honestly, they're just so interesting. And a lot of times when which happens a lot, of course, both with patients and with people who are just interested socially, like people ask me questions, and there's so many interesting kind of thoughts come out of it. Like I think, or they give me lots of interesting perspectives. So I enjoy the intellectual part of this, all of this. And of course, the healing part, because that's the best, when you see a patient come in and the patient says, well, this got better, this got better, this got better. And we didn't even try to make the other things better. We were just focusing, well, kind of on the main thing. But because functional medicine, it's never one thing, it's always a combination. So usually you feel better in many ways, not just whatever the problem, the initial problem. So that gives me kind of a lot of pleasure. It's a good thing. It's a wonderful thing. So, but thank you so much for having me. I really enjoyed listening to your own accounts, and thank you for just giving me like a platform to discuss my book. Thank you.
Absolutely. Yeah, thank you so much for being here today. Thank you to everyone who attended. And for anybody who's interested in learning more about Whole You, as I said, we focus on career and life strategy, wellness, career, and service. We have a weekly community meeting, wholeyou.info/community is where you can hear more about it. I'm joined by the sirens of the city. Another way, if people are in career transition, I'm going to put up this same website, wholeyou.info/free workshop, capital F, capital W, free workshop. But yes, thank you so much for being here. Thank you, Golnaz, Patrick, Lily, others. Thanks for attending. We were going to post this video. I know some people said they weren't going to be able to attend today, but are looking forward to hearing Dr. Azizian's wisdom. So we'll post that and I'll circulate it in the channels and see you online. Thanks, everybody. Take care of your skin and your health, and try to eat healthy, right? But have some fun too, but be mindful, right? Maybe if you think or suspect something might be having a reaction, just limit it, do an elimination diet and sort of like add it in slowly, right? And just be more mindful of how you treat your temple. Thank you so much. Have a good day.
Thank you.
Bye-bye.
Thank you.